So in our previous video, we have discussed about the types of stroke, that is ischemic stroke and hemorrhagic stroke. And we have completed the ischemic stroke, which is of two types, that is embolic and thrombotic stroke. Now we will just see a few details regarding the hemorrhagic stroke. It's less common than the ischemic stroke. We have mentioned the incidence earlier, but it's more deadlier with severe symptoms than the ischemic stroke. But if the person survives, and there is a chance of functional recovery, because in ischemic stroke, if the blood supply to the brain is stopped in ischemia, so there's a complete cessation of the blood supply to a particular area, and the tissues there die, and these do not regenerate. Whereas in hemorrhagic stroke, even though there is pressure from the blood, it compresses the brain and kills few cells. But when the hemorrhage is removed, few of the functions return gradually. The cells have not died, but the functions have been affected. It can be regained gradually. So we have already discussed about the types of hemorrhagic stroke, that is subarachnoid hemorrhage and intracerebral hemorrhage. Intracerebral hemorrhage is accounts for the 10% of the total cases, and subarachnoid it is around 5% of the cases. In subarachnoid, the blood vessel on the surface of the brain leaks, bleeding into the space between the brain and the skull, that is between the meninges. And intracerebral hemorrhage, that is into the cerebrum, that is defective artery in the brain burst, and this bursting occurs in both cases. The most common cause is an aneurysm. It's a blood-filled pouch that balloon out from the weak spot in an artery. Sometimes in the arterial wall, a small injury to the arterial wall, it can form a blood-filled pouch in the wall since it is elastic, and it bursts, leading to hemorrhage. And especially it's called as Berry aneurysm in the brain. And also advancing age, as age progresses, more chance of hemorrhage is there. Then in congenital malformations, then aggravated by hypertension. Again, hypertension, more blood pressure, there are more chances of hemorrhage, and also head injury is also an important cause for hemorrhage. Now we'll just go through a pathophysiology of a hemorrhagic stroke. What happens when the hemorrhage occurs? Usually when the hemorrhage occurs, there is an explosive entry of the blood into the brain parenchyma, and it structurally disrupts the neuron arrangement. What happens is that the white matter fiber tracks, these are split. This becomes split due to the explosive entry of the blood. And there is an immediate cessation of the neuronal functions. An expanding hemorrhage, it can act as a mass lesion. It can cover a large area and it can appear as a mass lesion and cause further progression of the neurological deficits. Large hemorrhages, it can cause transtentorial coning. It is called as transtentorial coning, means when the pressure inside the brain it increases, maybe due to swelling or bleeding, it applies pressure in the tentorium cerebelli. That's the partition between the cerebrum and cerebellum, and it can cause a herniation through it. It's called as transtentorial coning, and it can cause a rapid death. Now we'll just see a few general features of a hemorrhagic stroke. There is a history of hypertension. So when we take the history of the person, you can see the blood pressure is elevated, and he will be taking medicines for the BP usually. The headache may or may not be present, and seizures and vomiting will be mildly present. The stupor and coma will be deepening in nature. That means it increases, the depth of the stupor, it increases gradually. As one by one the functions reduce, the coma or the stupor, it increases. Sudden onset, usually sudden onset. Whenever the hemorrhagic stroke occurs, it occurs suddenly. Than the ischemic stroke, because ischemia, it takes time to manifest. Whereas hemorrhage, it can occur suddenly. A blood vessel can break suddenly and can cause sudden symptoms, sudden stroke. So that is an important distinguishing or differentiating factor between to know clinically whether it is a hemorrhagic stroke or a ischemic stroke. It's of sudden onset and headache may be present. And the recovery is either no recovery or delayed recovery is seen. But once recovered, few of the functions can gradually be regained since the pressure of the hemorrhage reduces. And there is no prodromal symptoms since it is sudden. And nuchal rigidity is an important feature. It's the inability to flex the neck forward due to rigidity of the neck muscles. It's usually seen in meningeal irritation. Whenever meningeal irritation is there, nuchal rigidity is seen. So here, subarachnoid hemorrhage, etc., it can cause nuchal rigidity. Now we will just compare the symptoms of the intracranial and the subarachnoid hemorrhages. Intracranial hemorrhage, its symptoms worsen over a period of 30 to 90 minutes. And symptoms can include sudden weakness, paralysis or numbness in any part of the body. The person will be unable to speak or control the eye movements correctly. Vomiting may be present. There will be difficulty in walking, irregular breathing, stupor and coma. It can occur gradually. In subarachnoid hemorrhage, a very severe headache that starts suddenly or thunderclap sign. It's called as thunderclap sign. That is subarachnoid hemorrhage and too severe meningeal irritation is present. There is a very severe headache and trigeminal nerve is also involved. The loss of consciousness will be there. Then nausea and vomiting is present. Inability to look at bright light or photosensitivity or photophobia, what is it called? It's involvement of trigeminal. Then stiff neck or nuchal rigidity is present because of meningeal irritation. Then dizziness, confusion and seizures are also present in subarachnoid hemorrhage. So we can summarize the most common stroke symptoms into sudden numbness or weakness of the face, arm or leg, especially on one side of the body. There is a sudden confusion, trouble in speaking or understanding things. So sudden trouble seeing in one or both eyes, and sudden trouble walking, or person is getting dizziness or loss of balances or coordination is present, and also a sudden severe headache with no known cause. So all these are the common stroke symptoms which can be assessed clinically. Now we will just see the difference of symptoms between the right hemisphere stroke and left hemisphere stroke. A stroke or a hemorrhage or ischemia can occur on the right hemisphere as well as the left hemisphere, and depending on that, there is a difference of symptoms. The right hemisphere, it controls the movement of the left side of the body. So whenever there is a right hemisphere stroke, the symptoms are seen in the left side of the body. And as well as the right hemisphere controls analytical and perceptual tasks, attention, memory, reasoning, and problem solving. So such activities are being controlled by the right hemisphere of the brain. And when we see such symptoms, that is alteration of memory or reasoning, we can know that it is a right hemisphere stroke. There is an impaired awareness of the illness, that is anosognosia. The person fails to admit that he is having such and such symptoms. So that is an impaired awareness of his illness or his present condition. Then in case of a diffuse lesion on the frontotemporal parietal area in the right hemisphere or a parietal lobe lesion, it can cause anosognosia. So patient will not be aware of his present condition. And left hemiparesis or paralysis can occur. Left-sided sensory loss will also be present. Then hemispatial neglect. This is a condition where there is a visual field neglect of the left side. So person will not be seeing the left half of the visual field. And dysarthria is also present in case of right hemisphere stroke. And mostly the nerves involved will be trigeminal, facial, glossopharyngeal, vagus and hypoglossal nerve. So in a left hemisphere stroke, the left hemisphere controls the movement of the right side of the body as well as the speech and language abilities, reading, writing, calculating. So all these motor functions etc. are controlled by the left hemisphere stroke. So a right-sided hemiparesis is seen in a left-sided stroke, along with aphasia, dysarthria, right-sided sensory loss and a right visual field neglect. So these are the symptoms of the corresponding right side stroke and the left hemisphere stroke. Stroke also can occur in the cerebellar area, so called as a cerebellar stroke. It's less common than the elsewhere, cortical, subcortical, etc. The cerebellum controls many of our reflexes and much of our balance and coordination. So any lesion in the superior cerebellar artery or anterior inferior cerebellar artery or the posterior inferior cerebellar artery, this can cause a cerebellar stroke. The cardinal signs include vertigo, balancing, then headache, vomiting and ataxia. That means the lack of voluntary coordination of muscle movements. It includes gait abnormality also. Then brainstem stroke is another condition. The brainstem is the area of the brain. It controls all the life support functions or the vital functions like breathing, heartbeat, and blood pressure, digestion, etc. As well as abilities such as eye movements, hearing, speech, swallowing, along with paralysis. So all these symptoms will be, all these functions will be hampered along with paralysis in case of a brainstem stroke. Stroke strikes fast. So stroke always, or most cases, it will be sudden, and it's a clinical presentation will be sudden. The person will be brought to your hospital or your clinic, maybe unconscious with the one-sided palsy, etc. And there is a acronym which is used as a mnemonic called as FAST, and each alphabet of this FAST is a symptom that helps to diagnose clinically diagnose the stroke at the earliest. And the treatment of a stroke, it depends on early diagnosis, because the more earlier we diagnose the condition, the less damage we can, the less damage to the brain occurs. And fast means F is for face. So you have to check the face of the person for any abnormality. So ask the person to smile. That's the basic question. Ask the person to smile. You can see the symmetry. If there is any loss of symmetry, there's a chance of a facial palsy. Arm, A for arm. Ask the patient to raise both arms. You see whether the arms have been moving equally up. So if the person fails to raise or move one side of the arm, then that indicates some kind of palsy. And then S for speech. Ask the person to speak a simple sentence and check while they're speaking, do they slur their speech or use any inappropriate words, or is unable to speak or repeat or recollect things. So you have to check for the speech. And the last one, T, is time. Time is very precious in stroke, and it is not to be wasted. If you see the first three symptoms, any abnormality in first three, don't waste the time. Just refer to a nearby hospital or give an immediate medical attention to the person.